So you've probably heard the term water pill, right? Sounds pretty harmless. But today, we're diving into one that is anything but simple. It's called Bumetanide, and it's a super potent medication used for some really serious conditions. Let's get into it.
But hold on a second. That kind of brings up a big question, doesn't it? I mean, we're all taught our bodies are mostly water, so why in the world would a doctor want to remove it? Well, the answer to that is exactly why this drug is such a game changer. All right, so here's how we're going to break this down. First, we'll tackle the problem itself, fluid overload. Then we'll introduce the water pill that fights it. After that, we're taking a deep dive right inside the kidney to see how this thing actually works. We'll look at the good and the bad, the power and the price. And finally, we'll see how it stacks up in the real world. Okay, let's start with the problem. And look, we're not just talking about feeling a bit bloated after a big meal. This is a whole different level. It's a condition called fluid overload or edema, and it's basically when your body's plumbing system goes haywire and starts holding on to way too much fluid. You see, this kind of fluid overload is a huge red flag. It's a sign that a major organ system is in serious trouble. For instance, if the heart is failing, it can't pump properly, and fluid backs up into the lungs, into the legs. With severe liver disease, that fluid can fill up the abdomen, and if the kidneys are failing, well, the body's own filtration system just shuts down. And you have to understand, in all these cases, that extra fluid isn't just uncomfortable. It is literally life-threatening. So, what do? How do you fight back when the body is, in a way, drowning from the inside out? You call in the big guns. And that's where our solution comes in, Bumetanide. Okay, the fancy medical term for it is a potent loop diuretic. But what on earth does that actually mean? Let's just cut to the chase. Bumetanide has one job, and one job only, to make the body produce a ton of urine. It's designed to flush out all that excess salt and all the water that's stubbornly sticking to it. All right, now for the part that's just fascinating. How does this one tiny molecule pull off such a huge job? To really get it, we've got to shrink down, Fantastic Voyage style, and take a trip deep inside the body's master filtration plant, the kidney. And our target destination? It's a structure called the nephron. You've got about 1 million of these little guys in each kidney. Seriously, 1 million. Just think of each one as a tiny, microscopic filter station. This is the factory floor where all the important work of cleaning your blood gets done. Okay, so here's the mission plan, step by step. First, blood comes into the nephron for cleaning. Now, as it passes through a special section, the loop of Henle, the body naturally tries to pull back any useful salt. But this is where Bumetanide makes its move. It's like a saboteur. It hones in on this very specific salt pump, technically the NKCC2 transporter, and just shuts it down, blocks it completely. Now that salt is trapped, it can't get back into the body. And here's the beautiful part. It's just simple science. Where salt goes, water is always pulled along with it. The end result? A massive flush of salt and water right out of the system. And get this, there's a bonus effect. It's pretty amazing, actually. Even before the big diuretic effect really kicks in, Bumetanide does something else. It tells the veins to just relax, to widen up a bit. And that simple action immediately takes a ton of pressure off a struggling heart. This is a huge deal in an emergency, like when fluid is building up in the lungs and you need relief fast. But here's the thing about something this powerful. It never comes for free. In fact, with Bumetanide, its greatest strength is, at the same time, its biggest weakness. So let's talk about that trade-off, the power and the price you have to pay for it. Yeah, the perfect way to picture Bumetanide is as a classic double-edged sword. Because really, all of its major side effects aren't some weird, unrelated problem. They're just the result of the drug doing its job a little too well. So the number one problem is that it can completely throw your body's electrolytes out of whack. I mean, by flushing out all that salt and water, you're also losing other critical minerals. The big one, the really dangerous one, is potassium. If your potassium gets too low, that's called hypokalemia, it can trigger deadly heart arrhythmias. But you're also losing sodium, magnesium, calcium. This is exactly why anyone on this drug needs constant blood tests. It is absolutely non-negotiable. And yeah, the list of risks goes on. If you push it too far, you end up with severe dehydration and your blood pressure can plummet. In high doses, especially given through an IV, it can actually be toxic to your hearing, causing ringing in the ears or even permanent damage. And as if that's not enough, by messing with your blood chemistry, it can also spike your uric acid levels, which might be enough to trigger an incredibly painful gout attack. So, okay,
With all those serious risks on the table, you might be wondering, where does this drug actually fit in? Let's pull back from the microscopic level and look at its real-world report card. So how does bumetanide measure up in the clinic? Well, this one number tells you almost everything you need to know: 40. It is milligram for milligram, 40 times more powerful than furosemide. And furosemide, you probably know it as Lasix, is the most common water pill on the planet. Being 40 times stronger, that puts it in an entirely different universe.
Now, that sheer power is one thing, but there's another advantage that for doctors might be even more important. It's predictability. See, with furosemide, when a patient takes a pill, you have no idea how much they'll actually absorb. It could be 10%, it could be 100%. It's a total guessing game. Bumetanide, not so much. It's predictable. You know you're going to get about 80 to 90% absorption every single time. And when you're dealing with a critically ill patient, that kind of reliability isn't just nice to have, it's everything.
So you can see where it gets used. The main target, the big one, is that severe fluid overload you see in heart failure. But it's also a go-to weapon for doctors trying to manage the extreme swelling that comes with advanced liver or kidney disease. For these very specific, very serious situations, it's an absolute staple in any hospital. At the end of the day, it all comes down to this. For a drug with this much horsepower, there's just no such thing as one size fits all. The only way to use it safely and effectively is through constant, careful monitoring. It's all about tailoring the dose exactly to what that one patient needs in that one moment, and not a single drop more. And that really leaves us with a pretty deep question to chew on, doesn't it? A drug like bumetanide proves that so often, a side effect is just the main effect pushed a little too far. So it makes you think, when you're dealing with something this powerful, where exactly is the line between a medicine and a poison?